Level 1. The Premed. Age 18.
You're 18. You told your mom you want to be a neurosurgeon. She cried. Happy tears. Your dad Googled how long it takes. He has not spoken since. You're at Ohio State University, pre-med track, biology, chemistry, physics, and a calculus class that feels personally designed to end your dreams. Your GPA needs to be a 3.7 or higher to even look at a medical application, not to get in, to look. You study in the library every night. You meet a guy named Derek who pre-highlights his textbooks before class, then highlights the highlights. You decide not to sit near Derek. The MCAT looms, 7.5 hours of testing. Biology, chemistry, psychology, critical analysis. It is graded out of 528. The average score of students who get into medical school is 511. You need to be above average just to be considered average. You take a practice test. You score a 498. You take it again, a 499. 6 months of Anki flashcards, Khan Academy, and UWorld question banks later, you score a 514. You apply to 25 medical schools. You get into one. You call your mom. She cries again. Your dad Googles, is one medical school enough? He still doesn't speak, but he nods once. That's his version of a standing ovation.
Level 2. The Medical Student. Years 1 and 2.
You're 22. You are now a medical student, technically. Mostly you are a person who memorizes things. The first 2 years are preclinical. No patients, just classrooms, anatomy labs, and the slow existential realization that the human body is extraordinarily complicated and you are expected to understand it all. Gross anatomy is week 1. You walk into the lab. There are cadavers on every table. Your lab partner, a very calm person named Derek, immediately names his. He calls it Gerald. You spend 18 months learning how every system in the body works, what goes wrong in each one, which drugs fix it, which drugs kill you if you give too much, and how to tell the difference. The pharmacology block alone covers 400 drugs. You learn mechanisms, side effects, drug interactions. Some drugs treat the same thing in different ways. Some have the same name but do different things. Medical naming conventions were created by someone who did not like you personally. At the end of year 2, you take USMLE Step 1, the United States Medical Licensing Examination. It is now pass-fail, but passing it is required to continue. You study for 6 weeks straight. You pass. You do not celebrate. You immediately start studying for the next thing. This is the metabolism of medical school. There is no finish line. There is only the next threshold.
Level 3. The Medical Student. Clinical Years.
You're 24. Years 3 and 4 are clinical rotations. This is where you finally touch patients. You rotate through every major specialty: internal medicine, surgery, pediatrics, OBGYN, psychiatry, family medicine. 6 weeks each, sometimes 8. Every attending is different. Every hospital is different. You are the lowest person in the room. Your surgery rotation is where you first see a neurosurgery case, a craniotomy. The attending, Dr. Vasquez, opens a man's skull with a tool that sounds like a hardware store. You watch the brain, the actual brain, sitting there, gray-pink, glistening under the OR lights. Dr. Vasquez works in silence. Every movement is precise. Millimeters matter because a millimeter off in the wrong direction is the difference between fixing someone and changing who they are forever. You stand there for 4 hours. Your legs hurt. Your back aches. You don't move. After the case, Dr. Vasquez pulls off his gloves and asks you one question. What did you observe? You answer for 3 minutes without stopping. He listens. He says, "Good." Then he walks out. You decide in that moment, standing in a hallway that smells of antiseptic and ambition, that this is what you are going to do with your life. You take USMLE Step 2. You score a 258 out of 300. High enough. You apply to neurosurgery residency programs. There are 120 spots in the entire country, around 250 applicants. You are not guaranteed anything. Match day arrives. You sit in a room with your entire class. Everyone opens their envelope at the same time. You match at Penn Medicine in Philadelphia. It is one of the top neurosurgery programs in the country. You read the letter twice, then a third time.
Level 4. The Intern.
You're 26. Intern year, the first year of residency. It is designed, as far as you can tell, to eliminate any remaining illusions you had about sleep, free time, or the phrase, "I'll eat when I'm done." You work 80 hours a week, on paper, The 80-hour rule exists. It is respected the way speed limits are respected, technically, in principle, with notable exceptions. Your attending on the first day is Dr. Okonkwo. He has the energy of a man who does not believe in unnecessary words. He hands you a patient list at 5 a.m. and says, know everything about every one of them before rounds at 6. You pre-round every morning. Check vitals, labs, imaging, overnight events for every patient before the attending shows up. If Dr. Okonkwo asks you something you don't know, the answer is never, I don't know. The answer is, I'll find out and have it to you in 10 minutes. You scrub into surgeries. You retract tissue. You hold things. You watch. Sometimes you place a suture, supervised. The first time you place a stitch in a human brain, your hand is perfectly steady. A patient crashes at 2 a.m., hemorrhagic stroke, blood in the brain, pressure building. You are the first responder. You call your senior resident, Dr. Park. She talks you through emergency orders while running to the floor. By the time she arrives, you've already done 2 of the 3 things she was going to ask for. She looks at the chart, then at you. She says, not bad. From Dr. Park, that is a 5-star review.
Level 5. The Junior Resident, PGY 2 through 3.
You're 28. You now supervise the intern. This is the first time in 4 years someone looks at you for guidance. It is thrilling. It is terrifying. It is mostly terrifying. Your surgical autonomy increases. You open and close. You drill burr holes. You place external ventricular drains, a catheter inserted through the skull into the fluid-filled ventricles to relieve pressure. You do this at 3 a.m. in dim light with a patient who is deteriorating. You do it correctly. Dr. Park is now your senior co-resident. She doesn't watch you as closely anymore. You notice when she stops watching. It means something. You start reading the literature, not because anyone told you to, because the questions you're seeing in the OR don't have clean answers yet, and you want to find them. You read papers on glioblastoma surgical margins, on the role of awake craniotomy and eloquent cortex tumors, on new stereotactic techniques. You read on the bus. You read while eating. You see your first pediatric neurosurgery case, a 4-year-old with hydrocephalus. A shunt is placed to drain cerebrospinal fluid from the brain. The procedure works. The child's parents cry in the hallway. You walk past them on the way to your next case. You don't slow down, but you carry that hallway with you for a long time.
Level 6. The Senior Resident, PGY 4 through 5.
You're 30. You are the person in charge of the floor on overnight call. The intern calls you. You call the attending only when necessary. You are the layer between panic and action. Your surgical volume is growing. Spinal fusions, brain tumor resections, aneurysm clipping, deep brain stimulation lead placements. Each operation has its own logic, its own risk architecture, its own moments where you must choose fast and choose correctly. An awake craniotomy case comes through. The patient, a 44-year-old high school teacher named Carol, has a low-grade glioma, a slow-growing brain tumor sitting in her left temporal lobe, the eloquent cortex, speech, language, the area that makes her, her. Awake craniotomy means exactly that. The patient is awake during the resection, sedated enough not to feel pain, awake enough to talk to you while you remove a tumor from their brain. You monitor speech in real time. If Carol starts struggling to find words, you stop. You don't go further. The surgery takes 4 hours and 20 minutes. Carol talks the entire time. She describes her classroom. She talks about a student who struggled with fractions for months and then one day understood them all at once. She talks about the look on that kid's face. You remove the tumor completely. Clean margins, no language deficit. In the post-op bay, Carol asks for a pen. She writes something down and hands it to you. It says, "Thank you for letting me keep my words." You put it in your coat pocket. You still have it.
Level 7. The Chief Resident. Age.
You're 32, chief resident, 7 years of residency, and you are now the one who runs the service, manages the schedule, mentors the juniors, and operates at a level that most surgeons spend a career reaching. Dr. Okonkwo, your first attending, the man of few words, gives you the most complex case on the board, a giant posterior fossa meningioma, a benign tumor but in a location near the brainstem and multiple cranial nerves. Wrong move, permanent disability. No move, the tumor continues growing. He scrubs in with you. He doesn't touch the instruments. He watches. 6 hours. You remove 98% of the tumor. The 2% you leave is draped over a cranial nerve. You make the call, preserve the nerve, leave the margin. The patient wakes up intact. Dr. Okonkwo finds you afterward. He says 4 words. You made good decisions. 7 years, 4 words. You don't need more than that.
Level 8. The fellow.
You're 33. You chose to subspecialize, skull base and cerebrovascular neurosurgery, the most complex real estate in the human body. Aneurysms, AVMs, tumors pressing on the optic nerves, the carotid, the basilar artery. Fellowship is 1 year at UCSF. The program is run by Dr. Lawson, who has a personality that can be described as extremely precise. She schedules post-operative teaching rounds for 6 a.m. on Saturdays, not because the hospital requires it, because she does. You perform your first pipeline embolization, a procedure where a wire mesh flow diverter is navigated through a catheter from the femoral artery up through the aorta into the cerebral vessels to treat an aneurysm without ever opening the skull. You watch it on fluoroscopy, real-time X-ray. The device blooms open in the vessel like a tiny silver flower. Dr. Lawson says acceptable deployment. You have learned that acceptable means excellent. You publish 2 papers during fellowship. You present at the Congress of Neurosurgeons annual meeting. Someone in the audience asks a question about your data. You know the answer before they finish the sentence.
The year ends. Dr. Lawson shakes your hand. She says, "You're ready." 3 words. The weight of them is enormous. Level 9. The attending. You're 34. Your name is on the door. Dr. Genza, attending neurosurgeon, skull base and cerebrovascular surgery. You have your own patients, your own OR days, your own residents who look at you the way you once looked at Dr. Vasquez. The first patient you see as the primary surgeon is a 67-year-old man named Arthur who has a ruptured cerebral aneurysm. The bleeding has already started. This is an emergency. You take him to the OR within the hour. Microsurgery. The microscope magnifies the field 20 times. You clip the aneurysm, a tiny titanium clip, smaller than a fingernail, placed across the neck of the bulging vessel to stop the bleed. You place it in under 4 minutes. You build your practice. You take the hard cases, the ones other surgeons refer out. The 78-year-old with a cavernous sinus meningioma, the young woman with a brainstem cavernoma that's bled twice, the child with a giant intraventricular tumor. You take residents into the OR and you teach, not because the hospital assigned you to, but because Dr. Vasquez once stood in silence while you decided something was your calling, and the least you can do is give someone else that same room. Level 10. The department chair. You're 52. You chair the Department of Neurosurgery at Penn Medicine, where you trained as a resident 30 years ago. Your CV is 38 pages, 214 peer-reviewed publications, over 4,000 surgeries performed. You have trained 31 residents who are now attendings at programs across the country. 3 of them chair departments of their own. The hospital is expanding the neurosurgery program. New intraoperative MRI suite, new endovascular lab, a research center focused on AI-assisted surgical planning. You fought for the budget. You won. You always win eventually because you do not mistake urgency for speed. You learned that from Carol, actually, from that note she handed you in the recovery bay 20 years ago. You still operate, 2 days a week. The cases you keep for yourself are the ones the residents call impossible. You don't believe in impossible. You believe in insufficient information. A third-year resident, Dr. Reyes, scrubs in with you on a complex AVM resection. She is technically gifted, fast hands, but in the OR, when the unexpected bleeder appears, she freezes, 1.5 seconds. Not long, long enough. You control the bleed without interrupting the field. Afterward, you debrief her. You say, "The hands know what to do. The job is to let them." She writes it down. You walk out of the OR on a Tuesday afternoon in October, past the recovery bay, past the resident lounge where someone has drawn a diagram of the circle of Willis on the whiteboard with a dry erase marker and a small cartoon face labeled, "Do not erase, studying." You do not erase it. You have spent 34 years learning how to work inside the 3 pounds of tissue that makes a person who they are. You have held living brains in a field of light. You have clipped vessels thinner than a thread. You have stood at the edge of what is possible and stepped past it enough times to know that the edge keeps moving. Some of the patients you saved don't know your name. That's fine. You didn't do it for the name. Arthur still sends a Christmas card every year. It always says the same thing. Still here, doc. 2 words. Every year. Still enough. Before we go further, comment below which specialty you want to see Genza tackle next. Hit the like button right now and subscribe because we drop a new one every week.